Hello friends, you are welcome to another exciting episode of Youth Empowerment Series. My name is Lady Dr. Sheila and this is Health Gist How. In this community, we gist about anything that has got to do with health. We gist about things that will impact on our youth positively. We discuss mental health, we discuss reproductive health, we discuss relationship choices, we discuss education, we discuss family, we even discuss economic empowerment. We are comprehensive because we want to impact on our youth positively and holistically. We want to make our youth well-grounded and all-rounded, as well as resilient as they transit into adulthood. If you are interested in topics like this, then you are at the right place. Don't move further. Come right in and take a seat. We are glad to have you. You are welcome. But before you forget to subscribe to this channel, because by the time you finish watching this video, you might forget to subscribe. Kindly give a thumbs up to this video and subscribe to this channel. Don't forget to turn on your notification bell so that when we post a video, you will be notified to check on it. Thank you. In our previous video, we talked about symptoms of cervical cancer. Before we spoke about symptoms of cervical cancer, we had already treated causes and risk factors of cervical cancer. Remember, we said this month, January, is a month that has been slated by the WHO for us to use to educate the public on cervical cancer and all that has got to do with it. Just as we do for breast cancer in every October, every January is also supposed to be used to educate the public on cervical cancer. So this month, January, back to back, we are doing cervical cancer. Today we are going to talk about prevention. This is the last video we are tackling on cervical cancer. Anytime you think of preventions, just think of causes, because it is what is causing the health challenge that we would be targeting to prevent. So if you remember the causes of cervical cancer we treated, just carry that and bring it here, because we are going to take those causes one by one and talk about how we will prevent those causes from affecting us. Great. So remember, we said in the video that we discussed causes and risk factors, we said the most important risk factor of cervical cancer is the human papillomavirus. Remember, we said the human papillomavirus, which is sexually transmitted, causes over 99% of cervical cancer cases in Africa. It is important for us to know that the most cost-effective way to prevent cervical cancer is by vaccinating against the human papillomavirus. That is what most African countries have not been able to do, and that is why the disease burden of cervical cancer is still huge in Africa. Most African countries have not been able to initiate the vaccination against HPV in their countries. Vaccinating women or vaccinating girls against the human papillomavirus is the most cost-effective intervention that can happen. And this is what the Western countries have done. This is what the developed countries have done that has kept their disease burden of cervical cancer very low. You can imagine, we said the human papillomavirus, this virus that is sexually transmitted, causes over 99% of this disease. If we succeed in vaccinating our girls against human papilloma virus infection, it is going to bring a huge burden of this disease down in Africa. So we have to do that. And thankfully, thanks to our policy makers, thanks to the Ghana government has initiated the vaccination against human papilloma virus in our country. This is one of the best things that can happen to our girls and women in this country. In the Western countries, vaccination against human papilloma virus is given to girls between the ages of 9 to 14 years. And this helps them to keep the disease in the low percentages, because vaccinating girls from age 9 means we try to protect them against the human papilloma virus even before they become sexually active. Remember, we said the virus is sexually transmitted. The best time to give and the best time for the vaccine to work is when the girl child is not sexually active. And that's why they give to girls between the ages of 9 to 14 years. The HPV vaccine, the human papilloma vaccine, has been introduced into our national vaccination schedule. So now girls from the ages of 9 to 14 years have the advantage of receiving this vaccine and protecting themselves from future cervical cancer if it was going to happen. So this is something we are happy about as health workers, as a woman, and as a health advocate. We are happy about this development in Ghana. Kudos to our policymakers and to our government. I will take this opportunity to advise all parents, all families, to encourage their girls between the ages of 9 to 14 years to receive this vaccine. Let's forget about all the myths and misconceptions flying around. Let's forget about all the things people are saying about the human papilloma vaccine that has been introduced into the country. Once you start having sex, you are likely to be exposed to it, and you never know the changes it does to your cervix, the changes it does to your body. So take advantage and take this vaccine and protect yourself from human papilloma virus infection. Great. So that is that about the human papilloma virus and its vaccination. Remember, we talked about other risk factors. We said this virus is the most important risk factor, but then there are other risk factors. We talked about smoking, tobacco smoking, and we also talked about second-hand tobacco smoking. So women who smoke tobacco should quit smoking it, or women who are considering or who are thinking of smoking tobacco should quit smoking it, because it will prevent them from a lot of health consequences: cervical cancer, breast cancer, and lung cancer, which is a popular one. Also, let's avoid secondhand smoking. The effect of secondhand smoking on the body is the same as the effects on the person smoking. So you, the person who doesn't smoke tobacco but hangs around people who smoke tobacco, you stand the same risk of developing disease condition that tobacco smoking will bring. And this includes cervical cancer and breast cancer if you are a female. And lung cancer is the most common one. So let's stop tobacco smoking and let's avoid hanging out with people that smoke tobacco. The other risk factor we talked about earlier in our previous video was overweight and obesity. Obesity and overweight have been linked with a lot of health consequences, including cervical cancer. So let's keep a healthy weight let's keep a healthy. How do we keep a healthy weight? We keep a healthy weight by eating healthy. We keep a healthy weight by increasing our physical activities. So let's eat healthy. How do we eat healthy? Let's avoid all the processed foods, avoid fatty foods, more fiber-rich foods. Let's eat whole grain. Let's eat fruit and vegetables. Let's eat natural foods. These are foods that are healthy for our body and will not let us put on unnecessary weight that the body doesn't need. Let us eat balanced diet. We all know what balanced diet is. So you have your good portion of protein, your good portion of carbohydrates, your vegetables, fruit. Let's eat balanced diet and let's eat what the body needs. Let's increase our physical activities. Let's exercise. Even normal walking is good for the body. Let's avoid the sedentary life that we live. Let's walk around. Let's do some form of exercise, even as we grow, to maintain a healthy weight together with a healthy food or healthy diet that we opt for. So the other risk factor we talked about in our previous video that we have to look at how to tackle it to reduce our risk is advancing in age. We said advancing in age is a non-modifiable risk factor. Most of the time we cannot do anything about it. But how can we ensure that as we advance in age, it will not be to our disadvantage? We can do this by ensuring we do our regular checkups. There are annual checkups that we are all supposed to do, whether we are sick or not. Let's have our annual checkups done. When it comes to cervical cancer, we do what we call pap smear. It's the gold standard for screening cervical cancer. Let's get our pap smear done during our regular schedules. Pap smears are not done every year. They are done between 3 to 5 years. When you do your pap smear and show it to your doctor will examine your results and let you know the next time you should do your pap smear. It can be 3 years, it can be 5 years, depending on what your doctor sees in your results. Just in case you are a lady above 30 years and you've not done your pap smear before, please use this year and do your pap smear. Use this month. In fact, use this month so that you don't forget, and do your pap smear this month as the start so that you can know your baseline and know when next you are to do your pap smear. If it tells into February, it doesn't matter. Just get your pap smear done and know your baseline so that you can build on that going forward. So we've come to the end of today's episode. But then we have to take our question for the day. Remember, we said this time we want our episode to be interactive. We want to gist, and at the same time, we want to learn. Question of the day. So we have just discussed things that can be done to prevent cervical cancer. But before you got to know these ones that we have discussed today, did you have any idea or have you heard of anything that was said that could be done to prevent cervical cancer? We want some of those myths and misconceptions. But as we discuss them, we are also dispelling them. The preventions are what have been discussed here. Any other thing that you've heard before or you know, you put it at the comment section. We want to know some of them myths and misconceptions, but we are taking the authentic and accurate information that have been given to you here. So let's run with that. Thank you for staying with me, and see you soon in our next video. Don't forget to subscribe to this channel if you have not still yet done it, and give this video a thumbs up. See you soon in my next video. Bye bye.